Hi everyone, today's topic is about integrative treatment of epilepsy. For more information, you can call us at 919-869-6661 or visit us at www.ciclinic.com. Seizures or epilepsy are temporary changes in behavior caused by problems with the electrical and chemical activity of the brain. Seizures may look and feel different from one person to the next. What happens during a seizure depends on the area of the brain that's affected. Epileptic seizures are episodes that can vary from brief and nearly undetectable to long periods of vigorous shaking. People with epilepsy in some areas of the world experience stigma due to the condition. The number of people in the United States who have epilepsy is estimated to be at 3 million. And it is estimated that 1 in 26 people in the United States will develop epilepsy at some point in their lifetime. About 1 out of 3 people with epilepsy live with uncontrolled seizures because no available treatment works for them. In 6 out of 10 people, the causes of epilepsy is unknown. The most common known causes include in newborns, brain malformations, lack of oxygen during birth, low levels of blood sugar, calcium, magnesium, or other electrolytes, inborn errors of metabolism, brain hemorrhage, maternal drug use. In older infants and children, the most common cause is high fever or febrile seizures. Rare cause includes brain tumor and sometimes infections. In older children and adults, the causes may include congenital conditions such as Down syndrome, genetic factors, and rare progressive brain diseases, and sometimes head trauma. In seniors, causes include stroke, Alzheimer's disease, and trauma. Remember, in majority of the people who have epilepsy, the cause is unknown. So if one already has a seizure disorder, there are factors that can trigger an epileptic seizure episode. They may include missed medication as the most common cause, lack of sleep or disturbed sleep, illnesses, both with and without fever, psychological stress, heavy alcohol use or even seizures after alcohol withdrawal, use of recreational drugs such as cocaine, ecstasy, etc. Some of the over-counter medications or supplements such as Benadryl, nutritional deficiencies, poor eating habits or dehydration, menstrual cycles or hormonal issues can trigger it. Flashing lights or patterns can trigger a seizure, and certain specific activities, noises, or foods can also trigger it. Seizures can be categorized in different types. One type is primary generalized seizures. They are widespread electrical discharges that involve both sides of the brain at once. They involve loss of consciousness and typically happen without warnings. Hereditary factors are important in many of these seizures. There are different subtypes of seizures such as tonic-clonic and absence seizures. Another type of seizures are partial seizures. Partial seizures begin with an electrical discharge in one limited area of the brain. Partial seizures may often be preceded by certain experiences, such as auras. They include sensory, psychic, autonomic, and motor phenomena. There are different ways of diagnosing seizure disorders. The most common one is the use of EEG to look for abnormal patterns of brain waves. Neuroimaging studies such as a CT scan or MRI may be used to look at the structure of the brain and usually are part of the workup of a seizure. Video and EEG monitoring may also be useful in different and especially in difficult cases. So how serious are seizures? Problems may range from minimal to injuries to emergencies and even death. The chance of injury is higher for people with uncontrolled seizures. The type of injuries a person may get depends on the type of seizure, how long the seizure lasts, where the seizure occurs, and if it develops into an emergency. If seizures cannot be stopped, or repeated seizures occur one right after another, permanent injury or death can occur. People with epilepsy can also die from problems that occur during or after a seizure, such as inhaling vomit. Death from drowning is more common among people with epilepsy. Drowning can even occur in a tub with only a few inches of water, so people who have seizures probably should stick to showers instead of baths. Despite the risks, it is important to remember that it is not common for people to die from seizures. Sudden unexpected death can happen in epilepsy. It is also called SUDEP. It occurs in 1 out of every 1,000 people with epilepsy. It occurs more often in people with poorly controlled epilepsy. About 1/3 of SUDEP cases show evidence of a seizure close to the time of death. No one is sure about the cause of death in SUDEP. Some researchers think that a seizure causes an irregular heart rhythm, breathing problems, or other problems in the brain or other body parts. SUDEP rarely occurs in children. So what's the best way to deal with somebody having a seizure? Number 1, stay calm. Most seizures only last a few minutes. Number 2, always stay with the person until the seizure is over. Number 3, pay attention to how long the seizure lasts. Keep track of how much time there is between the beginning and the end of the active seizure, how long it takes for the person to recover and return to their usual activity level. Prevent injury by moving nearby objects out of the way. Make the person as comfortable as possible. Help them sit down in a safe place. If they are at the risk of falling, get someone to help you and lay the person down on the floor. Support the person's head to keep it from hitting the floor. Make sure their breathing is okay. Lie down the person, turn them to their side with their mouth pointing to the ground. This will help them breathe more easily and keep saliva from blocking their airway. The next step is don't hold the person down. Next is don't put anything in the person's mouth. Next is do not give water, pills, or food by mouth unless the person is fully recovered and alert. Keep onlookers away if in public. Ask someone to stay nearby in case you need more help. Be sensitive and supportive and offer help to the patient having the seizure. Notify the treating physician of the seizure and ask for guidance, or take the patient to the emergency room. It is important to know when to call for emergency medical help. In the US, call 911 if a seizure lasts 5 minutes or longer. One seizure happens right after another without a person regaining consciousness between seizures. If seizures happen closer together than usual for that person. If a person has trouble breathing. If the person appears to be choking. If seizures happen in water, like in a swimming pool or bathtub. If the person is injured during the seizures. If you believe this is the first seizure the person has had, or if the person asks for medical help. The integrative treatment of seizure disorders can include identifying and treating reactive hypoglycemia, usually with diet, identifying and treating any food allergies, avoiding artificial sweeteners, especially aspartame, avoiding alcohol, and in younger patients, a ketogenic diet may be effective, especially in difficult to treat cases. Some of the supplements that might be helpful in the treatment of seizure disorders may include vitamin E, magnesium, pyridoxine, taurine, manganese, and DHA-EPA. All of these treatments need to be prescribed under the care of a knowledgeable healthcare provider. There are many medications that can be used in the treatment of seizure disorders. The common ones include Tegretol, Lamictal, Trileptal, phenobarbital, Valium, Topamax, Depakote, etc. I hope you have found this presentation helpful. For more information or make an appointment, you can call us at 919-869-6661 or visit us at www.ciclinic.com. Thank you for your attention.